this is Nurse Kitu. I'm back with you with another video. Yay! So I thought I would talk today about what are some different opportunities and specialties in the nursing field. So a lot of people always assume once you're a registered nurse or a LPN that you, or even a CNA, you only work in the hospital. As soon as I tell people that I'm a nurse, when I meet them for the first time, they always say, oh, what hospital do you work at? Well, I actually don't work at the hospital. I worked at the hospital in my nursing career, I would say from CNA to a registered nurse. I think I would say about 9 years. I worked 6 years as a patient care tech or CNA, and then I worked 3 years as a registered nurse at the hospital. So what are the different opportunities for nurses out there? Because a lot of nurses, I will say, they do get burnt out when they're working in acute care setting for a long time. And so there are other things that you can do. You don't just have to work at the hospital. In the hospital itself, there's so many specialties. You have your staff nurse that's got their 6 patients, like for instance if they're on med surg, 5-6 patients. You have critical care, you have the PCU, you have the cardiac floor, pediatrics, you have mother baby, labor delivery. There's so many different specialties you can work in on the floor. You could be a staff nurse, like which I already mentioned. You could also be an assistant nurse manager, or you can be the nursing manager. Usually in a skilled nursing facility, the manager is usually the DON, director of nursing. But what other opportunities are there for nurses other than the bedside? So I have my little notebook here so that way I don't forget what I want to say. So the first opportunity I'll talk about is your local health department. I talk about it because that's where I work at, so I know about it. The local health department, there's so many specialties depending on what how your health department is. Some health departments are FQHCs, which is a federally qualified healthcare clinic. I used to work for FQHC, but now I do not. Usually FQHCs, they will have primary care, they will have your regular, STD clinic, immunizations where kids come in and adults get their vaccinations. You also have, they will offer maternity services for pregnant women and for their well woman checkup. What else do they offer at the local health department? Dental care as well. So yeah, that's what you can do at the health department. The health department, just depending on how it's run. Like for instance, in my health department, we have Healthy Start, which I work for, and we specifically deal with pregnant mommies and babies. But I would say that I don't only wear the nurse hat, but I also wear the social worker hat in providing resources and referrals to pregnant mommies and babies. What else? Am I missing anything else as far as the local health department? That's what you can do in the local health department. You could work in TB or refugee health. That's where the tuberculosis clinic and where you have, refugees coming from other countries, making sure they're up to date with vaccinations, getting their health history and whatnot. And so when people may come in from another country, the health department may be their first access to care, getting access to care. That may be the first place that they go to. So again, there's so many different things you can do at the health department as a registered nurse or LPN. Nurses also work at urgent care facilities or freestanding emergency rooms, doctor's offices, and there's so many specialties depending on which physician you work for. So for instance, you could be a cosmetic nurse. If I had to go back, I probably would dab into this a little bit more. You're a cosmetic nurse. They're the ones that are giving you your fillers, your Botox fillers. I don't have any. I need some, yeah. When you do your smile lines and, if you look here, wrinkles and stuff. But yeah, if I had to go back, I would love to go into or learn about cosmetic or dermatological nursing. There's forensics nursing. I love watching like Criminal Minds and SVU, and that may be interesting for somebody. Granted, TV is not what it would be like, but if you have an interest in forensics, you could work in that field. Nurse educator, I love teaching. So I guess I would consider myself a bit of a nurse educator. I taught LPNs for a year, and now I teach CPR. My orchid's kind of getting in my hair. Nursing education, you could work at a university, a college of nursing. You could work at a CNA school. You could work at an LPN school or practical nursing school. So those are the different opportunities you can for education as far as working as a nurse. You could be a case manager. A lot of case managers work at hospitals, managing that patient's care. They're not exactly doing bedside nursing, but they are helping them to be set up with their physician once they get out of, or discharged from the hospital, and then as well as setting up home health, physical therapy, occupational therapy if they need it. Another specialty is mental health nursing. Some nurses go back and become a psychiatric nurse practitioner, or a registered nurse could work at a psychiatric facility and helping those that have mental health conditions. There is also nursing informatics. So if you are familiar with healthcare, most healthcare systems now are using what's called the EMR, which is your electronic medical record. We're trying to stay away from paper, okay? And so nursing informatics, they are on the front lines, trying to make the database systems that we use to document and chart in, making them better. More efficient, so that way we can have less medical errors. And so if you're really kind of geeky, techie, this could be another avenue for you in learning about nursing informatics. Let's see, you could be a school nurse. So my local health department, we employ school nurses. They have several different schools that they go to, and that they could do, we still check kids for lice in their hair, making sure that their immunizations are up to date, to prevent the spread of communicable diseases. What else does a school nurse do? They do a lot of education with their, they could do a curriculum presenting different health topics to the kids at the school, like in high school. Let's see, you could work at a prison or a jail. A lot of the inmates, they need medical care just like everybody else. And so a nurse working at a jail or prison would be responsible, for giving the inmates the medications that they need. I've been to a prison for clinicals. Wasn't my cup of tea, but there are some nurses that enjoy it. You get a little bit more pay. I guess you call that hazard pay, because of, the risk that, depending on, let's say if you're working where those inmates are in there for life. So you could put yourself at risk, of course, because it's criminals, for violence, and other situations. So I went there for clinicals. I was scared. I can't do that. I don't have the personality for working in the prison. But I've met nurses that have, and they enjoyed it. They did it for many years. You could also be occupational health. So most corporate offices, they have some sort of a wellness program. And so usually a nurse practitioner may be there to do like a physical and whatnot. They may provide vaccinations before going into the workforce. So you could be an occupational health nurse. Let's see. You could also be a home health nurse. So that would be a nurse that would go and provide services in the patient's physical home. I kind of consider myself a home health nurse, but I work for the health department, so I do more education when I go into the client's home. I'm not doing actual nursing care. Like home health nurses could do wound care. They could be administering different types of medications, things of that nature, but I don't really do that. When I see my pregnant mommies and babies, I am doing a lot of education. I will check their blood pressure, their weight. I will measure the baby, go over their developmental screenings to make sure that the baby is meeting all their milestones, but I'm not really doing medical or nursing care. The most invasive thing I do is probably a blood pressure, but some programs could do fetal monitoring, like checking the baby's heartbeat if the mom is pregnant. And there's also another specialty I wanted to point out, which is travel nursing. You would obviously be working in an acute care setting. There's also strike team nursing. I didn't know anything about strike team nursing until YouTube. Looking at YouTube videos, you learn so much information. And so strike team nursing in the South, we don't really have unions. But up north, like in New York, Michigan, I want to say Chicago, they do have unions. And so if the nurses in a hospital, they call a strike, they're not happy with the ratios of nurses to patients or the pay, they could go on strike. And so now different agencies will call nurses to come in and help them to continue to care for their patients, because the hospital still has to accept patients, but the nurses are the core of giving patient care, as well as your CNAs. And so if they go on strike, then they call nurses from other different locations to come in and work. So a lot of times that can be lucrative for southern nurses, because our pay isn't as much as the northern states. And so they would fly up, they would have a contract for like 13 weeks and get the nice little the coins for going out there for however long their contract is. So that's another opportunity for nursing. So this is, I talked a little bit about acute care, but I also talked about what are some other opportunities for nurses outside of the hospital. So these are the different areas. If you're looking, you're like, you know what, I'm over bedside, I want to do something different. These are the different opportunities that exist. And I forgot one more, which I'm trying to venture in, is nurse entrepreneurship. And so a lot of nurses want to have their own business. They can have their own group home, or they can have their own home health agency. They can have their own CNA school. They could be a CPR instructor. These are the different things, or you can come up with your own idea. Nurses, time and time and again, I got a phone call come through because I'm using my phone to videotape this. So nurses are the #1 profession, again, time and time and again, on the Gallup poll, because we are, a lot of people, people keep calling me while I'm trying to shoot this video. Time and time and again, people trust nurses with their healthcare decisions. So many times when I worked in primary care, physician would come in, explain the diagnosis, the physician would leave, then I would go and discharge the patient, and then guess what? The patient's like, nurse, I don't understand anything the doctor said. Can you go ahead and explain it to me again? Because they feel that, we can explain it maybe more simply, or maybe not so rushed, or they just feel more comfortable asking us certain questions. Sometimes patients can be intimidated by providers. Not all providers are that way. I hope this was helpful. This just gives you an idea that not all nurses work in the hospital. They could work in a different area or specialty of nursing. There's so many, there's probably even more specialties that I didn't get to mention here. But yeah, just do a quick Google search and you will find out that nurses work everywhere. So I hope this was helpful, and I will see you next time. Bye. Oh, don't forget to subscribe and like, and to hit the notification bell. Okay? All right. Bye.